guidance is aimed at keeping those who are elderly and vulnerable away from such units. But intensive care consultant Dr. Ron Daniels said healthy 30-year-olds wouldn't have to follow the measures as closely. This all comes as the chief executive of the NHS warned doctors they will have to step into situations they are not properly prepared for. And Dr. Ron Daniels and former NHS nurse Rebecca Butler join me now to discuss whether these guidelines are necessary. Thank you very much indeed for joining us this evening. If I could just start with you, Dr. Daniels, are these guidelines too harsh? I mean, it's heartbreaking, isn't it? Especially for 90-year-old people who've been with their partners for decades to not be able to say goodbye.
So on the face of it, these guidelines, and they are guidelines, these aren't rules, might seem distasteful and they might seem harsh, of course. But we have to be mindful of why these guidelines have been put in place. This is not about stopping the husband of a wife they've been together for 50 years from saying goodbye to his wife, for example. This is around the extended family. This is around the fact that some patients in intensive care units have 10, 12, 15 or more people who want to visit them. And we can't allow that to happen at the current time because, of course, that's putting those individuals at risk, but also providing huge vectors to disseminate this virus.
Well, Rebecca, what do you think?
Well, I have to say I agree with Dr. Daniels. I speak from a time when HIV was the big health scare. That's when I was a senior sister on the renal unit. And in those days, I'm afraid to say it, our priority was treating our patients, not the visitors, and we treated the ill, not the well. And we didn't have really particularly long visiting hours. We used to throw people off the wards after half an hour. We've had a sort of a golden age of medicine, as it were, since those days. And patients' relatives are very much involved in discharge decisions, for example. But I'm afraid I'm with Dr. Daniels on this. We are treating sick people. Dr. Daniels is an intensivist. 140 odd people die from sepsis every year. You can't use up these valuable staff time on relatives. You can't have a situation where you've still got other patients treated in intensive care units. You've got trauma patients, you've got stroke patients, you've got sepsis patients. They can't all be exposed to coronavirus brought in by relatives. And it is harsh, but Kate, we're in a time where what we all took for granted as personal liberties, they're all going to be taken away. And I'm afraid we are there to treat sick people. And it is really sad. It is really probably only going to be confined to people on the ITU. Yeah. And it's really treating the other patients. We have got to... It's the bigger picture. I understand. We have to move away from individualism and we have to look at the herd and we have to protect our herd, I'm afraid.
Indeed. And in terms of looking at the herd then, Dr. Daniels, could we then, perhaps as a compromise, in certain circumstances, case-by-case basis, send more people home to die if their relatives are fit and healthy, and also that allows that whole process within hospitals to care for other patients? Is that possible?
Well, look, where a patient's approaching the end of their life, and I'd want this for myself, where it's possible, of course we would want that patient at home to die in peace, surrounded by their loved ones. Of course we would. The reality is for intensive care patients, that is almost always not possible, in that they wouldn't make it home. They're often on so much organ support that they'd pass away before they even got into the ambulance to take them home. So whilst we'd love to do that, it's usually not feasible.
Well, indeed, Rebecca, also, is it a case of not everybody would be affected? Is it possible to allow those who are fit and healthy also to be able to attend?
Well, how do you judge that? Unless you actually test people on the door of the intensive care unit, how can you protect the other people? How can you protect the staff? You can't. And I think really these decisions are absolutely best left to the clinicians. They're the ones who are in charge of the treatment and they can see the bigger issue. Intensive care units may not even look like we see them today. They may decide that they're all isolation units. They may designate whole intensive care areas as isolation units. So there isn't individual isolation protection. We don't know where we're going with this because even on the government's best numbers, 20,000 patients requiring ventilation for what, 2 weeks, 3 weeks? I don't know what the mean stay on ITU is for coronavirus patients. You're looking at 60,000 patient days on an intensive care unit. On the best case scenario, everything is going to change the way it looks. And clinicians understand, they understand how important relatives are, but I'm afraid I do have to keep saying it. The herd is more important, the staff are more important than individual feelings. And I know the doctor wouldn't say that, and I feel a little bit more at liberty to say it, but I'm afraid the niceties are going to have to take a step sideways for a little
while. Dr. Daniels, sorry, Rebecca. I mean, Dr. Daniels, that's the case, isn't it? It's how long could it actually go on for? It could end up being a question, as Rebecca says, of logistics, if so many people are actually in hospital and dying at the same time as well.
Well, absolutely. And frankly, most clinicians on the front line, we do not want to think about the worst case scenario. We're preparing for the best and the intermediate case scenarios. The worst case scenario is going to hugely challenge our NHS and really redefine the way we use healthcare services, not just during this crisis, but for many years to come thereafter. That might have the positive effect of redefining and refining society's expectation of healthcare, including free access of visitors at all times of day and night.
Indeed. We'll have to leave it there. Rebecca Butler and Dr. Ron Daniels, many thanks for joining us this evening.
Thank you.
Thank you.
And I'll be back with more news at 9. Thank you.